Well, I'm absolutely delighted now to be joined by Dr. Richard Memo, who is the chair of the Urology Care Foundation. Dr. Memo, welcome.
Thank you.
Thank you very much for talking to us.
It's my pleasure, thank you.
Now, it's the first meeting of the Urology Care Foundation here at this conference. Tell us a little bit about the Urology Care Foundation.
Well, the Urology Care Foundation is the official foundation of the American Urological Association. And 2 years ago, the board of directors of the AUA, the American Urological Association, decided to reorganize the foundation and has asked me to be the chair. Our goal is to support patient education and research. Our goal is also to identify the needs of urologists and patient education needs and to address them and keep the foundation in a contemporary mode.
Now, it would seem to me that supporting research in a field like this is really important activity for you guys to be doing.
Yes, research for us is a dual role. First of all, we try to encourage researchers. We try to encourage entry levels at medical students, residents, fellowship, and young faculty levels. And then we also attempt to get partners and support research that is being done around the country. Our third goal is to make sure that donors know there's a transparent process for picking researchers, following through, and making sure the donors receive the recognition or the results they're looking for.
The actual foundation of your board is quite innovative in itself, isn't it?
Yes, this is the first public philanthropic foundation of the long history of the foundations. This is our first attempt at involving laymen in the organization and the board of directors. We have 3 lay members. We have Sam Cavelli, who has about 250 Panera stores around the country. We have Tom Cavalier, who is a managing director of Stiefel Nicholas, an investment firm out of St. Louis. And we have John Hirschbeck, who is a baseball umpire. He was the head of the Umpires Union and is a survivor of testicular cancer. In addition, we have 3 urologists. We have the treasurer of the American Urologic Association, Steve Schlossberg, and we have 2 at-large urologists, one John Forrest from Tulsa and Marty Deneen from Florida.
And my last question, you know, you're doing all this activity, you've got this great board behind you. How difficult is it in this modern age to get the message out, to have a clear brand about what you're trying to achieve? Well,
it's in the area of patient education, things have changed. The gap between the patient's information and the doctor's information has narrowed. But the patient still needs a pointer to help determine what is appropriate treatment and what is not, based on guidelines and patient guides. In the area of research, it's important that people who are interested in supporting research know that we can help do basic science research, clinical research, translational research, and that we are there to make sure they get bang for their buck.
Well, thank you very much indeed for joining us, and I hope you have a great meeting later on today. Thank you.
Thank you very much.